Hi, everyone. I'm just letting people log in and get settled. It looks like people are joining with us. While everyone is logging in, I'll just go over a few housekeeping bits before we get going properly. So just to let you know that no attendees are visible or audible during this event. So we can't see you. Hopefully you can see and hear us okay. But you can ask questions in the Q&A function. I'll be keeping an eye on that, as will the speakers, and we'd really welcome questions. This is really about evidence gathering. It's about, provoking conversation. So do feel free to get involved there. You can tweet if you use the hashtag vaccine passports, and we're at Ada Lovelace Inst. So do tweet there, we'll keep an eye on that. And then I think the last bit of housekeeping is that we're really grateful to Catherine, who's with us. She's a closed captioner. So she'll be doing closed captions live as we go. If you look at the bottom of the screen, if you'd like that functionality, you can just press that button. And we will be recording the event and putting it up on our website later. So I think that looks like we've got almost everyone with us now. Great. So I'll start the event properly. So thank you all for joining us, and welcome to today's first public evidence gathering event on the history and uses of vaccine passports. And as part of this wider project we're doing looking at vaccine passports and COVID status apps. My name's Imogen Parker. I'm the head of policy at the Ada Lovelace Institute. For those of you that don't know us, we're a research and deliberation institute. We're independent, we're based in the UK, and we've got the remit to ensure that data and AI work for people and society. Now, the topic for today, I'm sure lots of you will have registered because you're following this as well, as countries are beginning to roll out their vaccinations. And in the UK context, certainly, there's this hope to be able to lay out some plans about how we move out of lockdown. Then the idea of a vaccine passport, it's something that's been talked about really since COVID spread, but now we have vaccines alongside it. It feels like it's really building momentum again. We've seen countries working on this. In mid-December, the WHO started work on their smart vaccination certificate, which would allow countries to prohibit travel on the basis of vaccination. We're seeing a lot of different countries come out to talk about this as well. Denmark announced yesterday that they're developing a digital corona passport to be rolled out in spring. The Greek Prime Minister has been advocating for an European Union-wide vaccination certificate scheme, and that has support from some other countries as well. Israel plans to roll out a green passport, which would grant some freedoms for those who are fully vaccinated. One of President Biden's executive orders aiming to curb the pandemic was asking government agencies to assess the feasibility of linking vaccine certificates with other sorts of documents and producing digital versions of this. We've seen international consortiums of private actors coming together to set standards. We've got some with us today. So it really feels like this is a fantastic time to have this conversation, to start to source some of the evidence and have the conversations about how this might work in practice. Of course, systems to identify those at less risk of disease have existed for centuries, and primarily perhaps the best well-known version or most widely used at the moment is the carte jaune, which is the official yellow fever vaccination created by the World Health Organization that's required today to enter into a lot of different countries. And it feels like with so many emerging proposals on the table, we thought it was really important to start with the history of this, to learn the lessons from previous experiences, and to also examine what potential use cases might be around this to ground the conversations. So that brings us to today's event and the four really fantastic speakers that we've got with us today to consider the history, the law, and some kind of practical examples of tools and standards under development. So we've got with us Jenny, is it Wanger? Sorry, I should have checked with you. Yes, who's going to speak to us about the work of the Linux Foundation Public Health have been doing around vaccination certificates. We've got Joseph Spear, who's going to talk to us about Mvine and iProve's pilot project, which is running in the UK at the moment, of a COVID vaccination and immunity passport. We've got Dr. Mark Eccelston-Turner, who's going to talk about the international health regulation and how WHO has used this in the past and now. And we've got Professor Sanjoy Bhattacharya, who's speaking to us about the history of this type of certification. And I wanted to turn to you, Sanjoy, first. You know, it's really easy, the way this is getting covered, it's almost seen as a modern tech innovation, but of course, health passports have been around for a really long time. Perhaps you could take a few minutes to just set the scene for us here on the kind of history of immunity passports, in particular your area of study around smallpox.
Thank you, Imogen, for the invitation, and pleased to be here. So, you know, discussions about certification, vaccine certification, are as old as vaccines themselves, especially in relation to the disruption of colonial and imperial trade. So the idea of certification actually first comes up in my research during pandemic outbreaks of smallpox, when there is fear that the transport of raw materials is going to be stopped from British India to the cotton mills of Great Britain because of extra strictures that are planned for entry of all goods into Great Britain, because there was this fear that smallpox matter might be carried over in cotton, and then workers and port workers in Britain might contract the disease and then spread the disease in smallpox. I mean, there are a range of such discussions going on. So basically, certification, early debates about certification seem to be connected in relation to avoiding quarantine measures, which were never welcomed by trading lobbies and trading guilds. They were also considered within colonial India, British India, during smallpox epidemic outbreak, simply because the disease was so terrible and killed so many people, but also disfigured the survivors in terrible ways. Blindness in 19th and 20th century India from among smallpox survivors was very, very common. So these were the sort of conditions in which British Indian governance would consider certification. But what is very striking is that when you look at unpublished papers, there is also agreement that it's very easy to announce certification, but exceptionally difficult to implement the paperwork and the legal frameworks, even in British India, which had many provinces and its own legal variations about certification. So envious glances were often cast from London and Calcutta and later New Delhi, the imperial power, the centers of imperial power at Portuguese India, where certification was actually made mandatory in relation to smallpox and was linked to school entry, marriage, or government employment. And apparently that worked. And one of the arguments made in relation to the independent Indian smallpox eradication program was that Goa was able to get rid of smallpox pretty early. It eliminated smallpox because of these age-old traditions of certification, which had encouraged people to be more pro-vaccination and pro-revaccination. So this is something I think we need to consider today. We're not just talking about vaccination certification, we're also talking about possibly revaccination certification, because a lot of discussion in scientific circles that we might be moving towards a flu-like vaccination regime where we get vaccinated annually. Anyway, it was pointed out then in British India that it was easier in colonial Goa, which was a small geographic unit, rather than a continental British India, which was, you know, just look at the subcontinent, the South Asian subcontinent, and, you know, it's huge. After World War II and the formation of the World Health Organization, discussions moved on to the certification to allow travel. So this was mainly about air travel. But again, it proved difficult to implement certification, vaccine certification, because governments would disagree about the value of certification from elsewhere. So, you know, who soon, very quickly, vaccine certificates took on a sort of national flavor and national identity, and hierarchies began to be created legally about which one was better and which one was worse. So forgeries and accusations of forgeries also abounded. For instance, in Britain, there was always a fear that Pakistani and Indian vaccination certificates could possibly be forgeries and therefore could not be trusted. And this issue becomes important when air travel comes in, because sea travel meant that a lot of people who had been infected with smallpox in India or Pakistan or Bangladesh or Sri Lanka, by the time they got to Britain, they would have contracted smallpox on the ship and then would be quarantined in the port. So it was air travel that led to discussions about vaccine certification. And sometimes when smallpox outbreaks did take place in Great Britain or Europe, Eastern and Western Europe, there would be accusations of inadequate governance or certification elsewhere. So sometimes, for instance, in Wales, there was a major outbreak in the 1960s, and that was then blamed on corruption and bad governance in Pakistan. And this then led to the souring of bilateral relations between Britain and Pakistan. And similar incidents then created souring of bilateral relations between Britain and India, which very interestingly then led to behind the scenes fears that NHS services might be severely damaged because so many South Asian practitioners had basically kept the NHS services going. I mean, we often forget historically what a huge role our NHS has played in providing us with good services, but those services are often provided by immigrant doctors from the Commonwealth who would have been expected to come in with vaccination certificates. And so there was a fear that bad relations would lead India and Pakistan to stop its doctors from leaving their countries and coming to Great Britain. So what this then leads to, and I'm going to end very soon, is it results in a greater reliance on publicly funded quarantine in the UK. So there's a greater use of quarantines at airports, and these are publicly funded. And again, this is something that is relevant today. We're having this big discussion about who pays for self-isolation, quarantine, and one of the reasons that people are going to avoid quarantine is if they can't afford to pay the £1,500 per person. The publicly funded quarantine increased the effectiveness of anti-smallpox measures alongside vaccine certification. And because it was so expensive, that is what then led to discussions about the need to avoid such expense, which then became justification for the importance of smallpox vaccination, revaccination, and the efficiencies that smallpox eradication could bring about globally. Because often when the sums and maths were done, not quite by management consultancy groups behind closed doors, but by sort of, economists trying to convince governments to pay money for smallpox vaccination, public money for smallpox vaccination, revaccination, and support for the eradication program, they would say that if we get rid of smallpox, that would be much cheaper than continuing to run extremely expensive publicly funded smallpox quarantine measures. What is fascinating in all this is that certification becomes less important in these discussions. Ultimately, the idea is that the focus has to be on implementation. And the moment the focus is on implementation, the implementers are always warning that implementation of certification is difficult. So, let's not use this as a PR issue. because we are going to get outmaneuvered. So I'll end there.
Thank you so much for those opening remarks. And it's just, I think, so it's great to ground it in the history, but also so telling how many of the issues you mentioned are front and center in the discussions at the moment about the development of these digital passports. So let me move now on to Mark. Mark, it would be great if you could, it looks like you absolutely can because your screen is going live with slides, but talk to us a little bit about what the international law is around this, what the state of play is on that element. Let me hand over to you.
So can you hear me and see my slides? Excellent. Okay, so I'm Dr. Mark Eccelston-Turner. I'm going to talk a little bit about vaccine certificates and international law and how that fits in with the equitable access to medicines issue. So before I start, naturally, I have to give an acknowledgement. My work on this is funded by the Arts and Humanities Research Council of the UK as part of their COVID-19 funding, and I'm very grateful for their financial support in this matter. So vaccine certificates were first, there's been a history of informal vaccine certificates, as we have just heard, being issued by different colonial powers around the world. We first see a real formalized, structured approach to vaccine certificates in the multilateral system through the 1969 International Health Regulations, which created what has been called the Yellow Book, this standardized, homogenized, internationally recognized system of vaccine certificates, and you can see a copy of it there on the left. Now, initially, the vaccine certificate applied to cholera, smallpox, yellow fever, and typhus fever. The smallpox eradication campaign was successful, and therefore the international vaccine certificate requirement was removed in 1981. The requirement for a cholera vaccine certificate was removed in the 80s, not because we have eradicated cholera, but because it was recognized, or it was decided that vaccination against cholera was not an adequate way to prevent cholera outbreaks around the world, and a similar story existed with typhus. So moving forward into the current international system, the 2005 International Health Regulations at Article 36 create this power for the requirement for international certificates of vaccination. And what it does is it removes barriers to entry for those who have received a vaccination. And if you are in and what Article 36 of the IHR says is that a traveller in possession of a vaccine certificate shall not be denied entry as a consequence of the disease to which the certificate refers. So you cannot prevent, if someone is a holder of one of these vaccine certificates, but they come from an area of the world where yellow fever is endemic, for example, you cannot deny them entry to your country just because they're from a yellow fever endemic country, for example. Now, in the current IHR, the International Health Regulations, Annex 6 of the International Health Regulations outlines the current vaccination certificate requirements. And the only virus for which, or the only disease which we require vaccination against, as in line with Article 36 of the IHR, is yellow fever. So there is still a yellow fever vaccination requirement. And if you come from a country which is considered to be endemic with yellow fever and you do not carry a yellow fever certificate, you can be denied entry on that basis. So only yellow fever is formally included within Annex 7, but diseases against, so WHO can recommend other vaccinations, and that list at Annex 7 can be expanded upon or contracted, as we saw with cholera and smallpox. So there's a history of this occurring since the 1969 IHR. I think it's necessary to distinguish vaccination certificates against this idea of immunity passports, which we've seen coming up again. The IHR and the international legal framework doesn't talk about immunity passports whatsoever. Now, immunity passports are concerned with certification that they have been exposed to the virus, and that therefore their exposure to the virus provides them with a degree of immunity or protection against the virus. And we have heard some talk about these being included or being possibly extended in regards to COVID. And it's necessary to distinguish the two of them, that immunity passports are not the same as vaccination certificates under international law. Immunity passports have no bearing in international law in that regard. Only vaccination certificates issued pursuant to the international health regulations are recognized in this way. But so there are a couple of ethical issues with vaccination certificates. As we heard from Sanjoy, there has been a history of potential fraud or accusations of fraud with regards to vaccine certificates under the previous model. And vaccination certificates do perform a public good in some circumstances. They can incentivize individuals to receive a vaccination because it opens them up to other more accessible travel and allow them entry into other countries. Whereas immunity passports incentivize infection, and that's a very different prospect. But vaccine certificates also come with some issues in regards to the ethics of these items. Making international travel conditional on holding such a vaccine risks creating a tiered system whereby only individuals who happen to live in high-income countries where the vaccine is being rolled out are able to travel internationally. Whereas if you're from a low and middle-income country where the vaccine isn't being rolled out, you do not have international travel open to you. So there's a real danger here that if we implement international certification for COVID-19 vaccinations, that we could create this two-tiered system, particularly given how inequitable the rollout of the vaccine is so far, and it looks like the rollout of the vaccine is going to remain. So you could end up with a situation where individuals from the UK could travel to a country in Southeast Asia, Africa, or Latin America, but an individual from that country couldn't in turn travel to the UK. So you could risk creating this two-tiered system. So there are quite big benefit. There are these potential benefits of rolling out a COVID vaccine passport system, such as the easing of the restrictions on international travel, and a more an easing of the return to international travel and international trade to pre-COVID levels. And possibly an easing of social restrictions or economic restrictions within country if individuals have been vaccinated. So you might see, whilst it's not linked to the international health regulations, you could see a situation arising where if you want to go to the pub, you have to show your vaccine certificate to be allowed entry. But there are there are these issues of this tiered, inequitable system. And the other issue which we have to bear in mind or have to consider is the fact that vaccine certificates can make liberty or make freedom, your ability to move internationally around the world or your ability to move within your country, dependent upon vaccination. And we have to consider if that is akin to a form of compulsory vaccination, particularly amongst vaccine hesitance groups, or particularly amongst social demographics who have higher rates of vaccine hesitancy or vaccine resistance than other groups. So there's a real issue that rolling these vaccine certificates out could create inequitability amongst countries, but also amongst groups within countries. And that's something we have to bear in mind. The other thing to bear in mind is that for it to formally count as an international vaccine certificate under the international health regulations, that would require an amendment to Article 7 of the international health regulations to have a COVID-19 vaccine recognized within the IHR. At the moment, none of the discussion around vaccine certificates seems to have pitched that idea directly to WHO. We didn't see it raised at this year's executive board, which happened a few weeks ago. We have the World Health Assembly in May later this year, so we may get some firm proposals there from the countries like Greece and Denmark, who are talking quite often about vaccine certificates. But at the moment, it seems to be a regionalized issue within the European Union to allow travel across the European Union rather than this worldwide issue. But that's something to bear in mind as well, is that it will require ratification through the World Health Assembly to recognize this change to the international health regulations. And I will leave it there for now, and I shall stop sharing my screen. Thank you.
That's brilliant. Thank you so much, Mark. That was really clear and helpful to know about the need for legislation, I guess, at a world, if this becomes world level. There's also been a request to share your slides, but we can follow up with that later. Let me turn now to Jenny. Jenny, you've been doing some really interesting work on this in partnership with the COVID-19 Credentials Initiative to develop some of those open standards on how this might work. It'd be great to just hear a bit more about that work and where you're hoping to get with it.
Absolutely, absolutely. Thank you. So I'll share my slides as well. And maybe I'll just start with a little bit about Linux Foundation Public Health. So we are a reasonably new arm of the Linux Foundation overall, and we have our main goal is to support open source software. All right, so open source software is software that anybody can come and collaborate on, can contribute to, can enhance. And it turns out that it takes a lot of work to make something with a community that's robust. And so as Linux Foundation, we specialize in these communities in making sure that there's open collaboration and all of the different ways in which the transparency and openness gets built in around it. And so that's really what we specialize in. And so Linux Foundation Public Health, we focus on the public health arm of that. With that, we started out with exposure notification technology, helping different public health authorities launch that technology, do it in an open and transparent way. And then we've recently had the COVID Credentials Initiative join us. And so we're now diving into the world of vaccine and test credentials. So our commitment is really to strong open source collaboration and how we get that together. So with that, a lot of how we do this is by building up relationships with public health authorities. We've got a large, robust Slack community of people talking about this technology every day. We're working with a wide range of countries and states. We've got, with our exposure notification technology, we've got in production across a number of states and countries. And we're really looking forward to bringing all of this power also to vaccine credentials. So as we look at vaccine credentials, right, we're really looking, here's the story of the paper card, right? So we've learned a lot right now about the history of it. How is it going to actually end up being, how are the vaccine certifications going to be used on a day-to-day basis in our lives? Is it still a really big question? What we see today and what we think is going to be most likely is that you go to the clinic, you get your jab, you then go to some other place where they say, I need to know that you're vaccinated. So you present the card that you got at the clinic, you present your driver's license or some other government ID with that, and they say, okay, these match, looks good, come on in. Of course, there's all sorts of problems here. The card around forgery, right? We've learned that there's a long history of forgery. There are all sorts of challenges around losing the card. It turns out that at least here in the States, it's very easy to get a second card when you're at the clinic if you just ask, and that one usually they won't write your name on it, they'll just give you the card. So you can spill all sorts and ruin the card and have to find another one, all sorts of challenges. Never mind the fact that your driver's license actually has a lot of information on it that you don't necessarily want to share, like your home address. And maybe when you're trying to get into the pub, while we do share that nowadays, wouldn't it be nice if we had a future where you didn't have to share both your health records and your home address and your birth date every time you want to go out for a drink with some friends? So we're looking at how to create a open source digital verification of some sort that has a couple of different pieces to it, right? The biggest one is that it's as privacy preserving as possible. So give only the very minimum information to the guard. We'll keep going with this pub example, even though I don't know that that's actually going to be where we end up needing to use these. But hopefully the bouncer at the pub, all they need to know is vaccinated, yes or no, and are you of a minimum age to enter the pub? And they don't need to know your name or your address. And I guess they also need to know that the phone that you're presenting this code on belongs to you, but keeping it as minimal as possible, right? We want to make sure that we are, yes, Sherzad, people will want to go to the pub. I agree. I want to go to the pub again. I miss it. But whether it's required to have a vaccine to go to the pub is a different question, and whether we have to have these certificates. And so what we're wanting to do, there's three critical pieces that we need to have in this, right? We need to have an issuer app. So when you go to the clinic to get your jab, to make sure that the clinic actually has the ability to say, yes, this is the person who got the jab, and give that and have the software such that your phone actually can say with cryptographic certification, with cryptographic certainty, yes, I'm immunized. Then there's the wallet. So on your phone, you have some form of code, some form of ability. And this can also be a printout, by the way, or it could be a plastic card with an RFID in it. There's many ways to have this technology to make sure it's inclusive of people who don't want to have this on their smartphone or who don't have a smartphone. You have a code on your phone, there's software for that to present it. And then the final piece is the bouncer at the pub or wherever else has a verifier app. So they can then scan your code and their app then says, yes, this is all valid. It's not forged. You can move forward with this person. So what we're really trying to do here is with using open source technology and the large community to create these 3 basic items and to create some of the standards behind it so that we can have multiple companies and participants within this ecosystem, right? We don't want to have it where large corporation X is the only one who can create an issuer app. And so every single person who wants to issue a certificate needs to pay large corporation X. We need to have it be an open system so there can be multiple competing companies running these things and so that we can have multiple options for the systems within one country and across borders. And then there's also needs for standards so that as we do cross borders, right, if I want to go visit the UK to go have a drink in that pub, I don't want to have to go to the UK and get another jab because they don't believe that the one that I got in the US is valid. So interoperability and shared standards on that side is also really critical. And we're working with the WHO on this. One of our leaders is sitting on their committee that's working out standards around this. We've been talking to W3C, there's a whole alphabet soup of organizations that we've been talking to in order to make this happen, because it really is, it requires massive buy-in across so many different groups. So there are a couple of challenges that we're facing around getting this out there, right? Sanjoy mentioned that announcing that these things are there is one thing, and then actually getting them in use everywhere is far harder, and that's what we're seeing as well. So there's emerging standards and technology, right? I've mentioned some of the things around interoperability and specifications. There's the infrastructure and the workflows, right? So not only does the clinic need to have the software to issue the certificate that says that they gave the jab, but the healthcare worker needs to know how to use the software. We need to make sure that everybody, that it links into your medical record, right? The electronic health records, if it needs to, that there's interoperability and infrastructure there. There's so many different pieces to this beyond just make a QR code. There's the communication and generating public trust, right? We need to also make sure that everybody understands that there are right ways and wrong ways to do this technology. We need to encourage the people who are asking us to adopt this technology to do it in the most privacy forward way possible and the most secure way possible. And then we need to communicate with the public about how that has been done, making sure that people understand that this isn't a tracking software. And one of the great things about verifiable credentials when done in a distributed fashion is that the clinic and the government, similar to using my plastic driver's license to get in somewhere, they never, the government never knows when I use my driver's license to try and get into a pub. And with these digital credentials, despite the fact that they're digital, you hold the data on your phone and you are in control of it. And so done correctly, nobody ever knows that you're trying to get into this pub or that pub. Or, and what you're doing. So we need to make sure we're communicating that it's very well understood by the public so that when we do really roll this out in force, there's good buy-in and good understanding of what's going on. And then the final thing is the ecosystem and building and trust and governance, right? This has been mentioned a couple of times before. How does one country know that those vaccine credentials are valid and acceptable by the other? So making sure that happens. So we've got a couple core activities we're doing. So use case and implementation work stream, rules and governance, and I'm going to skip over this quickly because I know I'm over time, and then a vaccine credentials focus group where we're working with public health authorities on what this is actually going to take. And I'm going to share these slides afterwards. There's all these different ways to get involved, so you'll find out about that then. Thank you all so much. Glad to be here.
Thanks so much, Jenny. That was a great whistle-stop tour of the work that you're doing and how that works. Hope to come back with more questions, but now let me now move lastly to Joseph. So Joseph, you have right now a digital COVID-19 passport being piloted in the UK. It would be great to know more details about exactly what that looks like, and in particular what you're trying to learn from the pilot.
Fantastic. I hope you can hear and see me clearly enough. Good afternoon, everyone. My name is Joseph Spear. I'm Director of Communications at British deep tech company Mvine Limited. We're based out of London, UK. And all that I'm about to explain to you this afternoon is funded work, publicly funded work from Innovate UK, which is part of the UK Research and Innovation. We were recipients of 2 grants. First, last year, with which we won a small envelope of public funds to create, in other words, to develop a piece of technology, a new innovation for the ability to prove something about someone is true without you having to explain who you are to someone you don't know. And that is the key precept that we try to create. We work alongside another leading company, a world-class company actually, called iProve Limited, also by sheer coincidence based in London. They are world-class innovators of genuine presence technologies. And what that means is they're able to use their technologies to prove that it's the real person, that it's really them right now. And so we brought together our piece of technology and their piece of technology, and we created what we believe to be a genuine world first piece of technology using public funding. The second piece of public funding that we won it was called Extension for Impact, and we're incredibly grateful to Innovate UK to spot the potential within our project to fund us twice over. And that gives us the ability to make outreaches to directors of public health in England, and there's 152 directors of public health in England. And the objective of the exercise there is to offer fully funded trials for directors of public health in their locality. So each director of public health would have a local plan. They would have priorities set within their local plan. And the directors of public health in England are very key, they hold a very key public position. On the one hand, they work with the local authorities where they reside in the local authorities, and then secondly, they also have a live correspondence with NHS, the National Health Service in England. So these individuals are incredibly important, and we're seeing over and over again the increasing importance that even central government, UK government, place upon these individuals for policy-led decisions on a local level. So we are presently offering the technology, the innovation to them for use in their locality. And I'm very pleased to report that we have had live inquiries from a number of them. And we also have live inquiries right now with a number of cities and towns where private sector and public sector organizations have expressed a keenness and an eagerness even to give the service evaluations, the trials, a go for themselves. So they would include very large general practitioner practices. One that we're speaking to has 85,000 patients on their books, for example. Another would be a world-class sports stadium, which itself is presently being repurposed as a super vaccination centre. But afterwards, they want to know how they can facilitate the return of people back into the stadium in a safe and COVID-friendly way. So you can see, can't you, straight away that there's a real practicality behind the innovation that we're trying to create. So a little bit about the innovation. So we bring together 2 main technology types. So as Mvine, we are specialists in identity of things and identity of people. So that is a very important point. And the reason why I bring that point out is because in this particular innovation, There's no identity information captured whatsoever. A piece that we read recently, all over again, was published by Privacy International on their website, privacyinternational.org. And in a few moments, I'll put the link into the chat for you. And one of their 3 conclusions from this piece read, if you want inclusion, the best option is to not require ID at all. Now, that is actually quite an astounding thing to say when you really think about it. In the UK, we had a government program and a government-sponsored software called the NHS app. So that NHS app was rolled out, first of all, in a trials basis, and then second of all, on a national basis. There was a mixed opinion, and there was a mixed reception for it. Where was the key thing that held it back? The main constraint that held it back was people's perception of what would happen with the data. Is it a matter of the surveillance state, tracking who I am, where I'm going, who I'm with? So the identity aspect behind that and other apps like that is a very, very important part. Where we differentiate this particular innovation is in the fact that it records, it captures, it stores, it processes no identity information whatsoever. And that makes it entirely different from anything else that's currently out there. So Imogen was very kindly saying that we are the only app of its type in the United Kingdom right now, certainly being rolled out in England right now. And I think that is quite an honest claim to be able to make, although it has to be said that Innovate UK have actually sponsored eight innovations in the general space of apps that do similar things. But from all that we've been able to understand from the others, ours is completely different in its construct, completely different in its design, and also completely based completely on different type of ethics. So what does it do and how does it work? So very, very quickly, someone would go into a vaccination center. They would be given a QR code. That QR code would be either scanned right in front of them or scanned just before they have their vaccination. They will have the vaccination, and then they would be asked to do a face scan. Now, the face scan is a very important part of the process because the face scan is not an identifier. It is a verifier. And that's very, very important for you to make that distinction. It's not an identifier, it's a verifier. The face scan actually is not at all a selfie. It's not a photograph. All it is a mathematical representation of somebody's face in a way that is, in a tech speak, it's called a hash. And what that means is that hash cannot be reversed back into a photograph. It cannot be reconstituted in another way. The only thing that can recognize that facial scan is another facial scan of an exact match, in other words, the same person. And that's what makes genuine presence assurance a very, very interesting piece of technology. And that's the reason why we partnered with iProve Limited, who are world leaders and world-class leaders in this particular field. So having had your jab, having scanned your face, having entered only the batch number of that vaccine, you're given a code, and the code, the facial scan, and the vaccine number then generates a completely unique to you QR code, and then that is stored on either your phone or given to you as a printout. So for people who don't have a smartphone or don't want a smartphone or have a cognitive reason why they can't use a smartphone, they are given something in print form that will then go on to become an attestation, a certificate, or a passport, if you like, of the fact that they have had a vaccination, the fact that they have had dose 1 of the vaccine program, dose 2 of the vaccine program over time, and they are then able to use that in a number of different ways whenever they are challenged. Remember, when they're challenged, they're not challenged to say who they are, they're challenged only to be able to prove something about them is true. And the something about them is true is I've had vaccine dose 1, I've had vaccine dose 2, or in fact, it could also be used as a, well, not an immunity certificate, but more a test status or test result status certificate, such as I've had a PCR test and this was the outcome of that test. I have done a lateral flow test, either in a test center or in my community pharmacy or even at home, and this was the outcome of that lateral flow test. So the app enables someone to be able to prove a test status, whether it's lateral flow or PCR, and in addition to that, the vaccine, as the person that received the vaccine dose 1, received vaccine dose 2. So that altogether makes it possible for both an individual citizen to be able to prove something about them is true without revealing who they are to someone they don't know, and also whenever challenged, such as going into a venue. We talked a little bit earlier about going down the pub and things like that, but it's also for, remember, for mutual assurance, for frontline workers if they are moving from one hospital to another, or if they are social care workers going from one social care environment, maybe a domiciliary care environment, into a care home. To be able to prove something about them is also true, i.e. they have had a vaccination dose 1, dose 2, or they yesterday did a lateral flow test at home, or they in fact had a PCR test 48 hours ago and this was the result. So I hope that really helps you understand the practicalities. Thanks very much for listening.
Thanks so much, Joseph, for laying that out. And there's been a few questions coming in on the chat and the Q&A to individuals that you might want to take a look at. But I wanted to put a question to the panel, which is, it's been really fascinating today because we've been looking at different bits of this whole, I guess, the whole idea of having a vaccine, digital vaccine passport kind of regime. I just wondered if you felt there were any areas where governments need to offer more clarity about whether or how this should be used, or whether we need new laws or regulations, or, you know, looking back from lessons from history, perhaps, whether there are any areas where, you know, there are certain tests that should be met in terms of how this gets rolled out. And I know all of you have, you know, you operate different spaces in this. I just wondered whether you think there's anything that would help everybody move forward with confidence. Yeah, Sanjay.
Yeah, so, you know, this comes back to something we've discussed before as a collective trust. Okay, so we have to look at each national context, and then we have to look at bodies that have public trust. And any passporting or certification that is developed has to involve those bodies. So for me, in the United Kingdom, a body that has trust is the National Health Service. The problem we have is we don't have a national government in this crisis, not like the Second World War. We don't have a multi-party governance structure. It's been mooted. I think it would be a fantastic idea. This is a major crisis, economic, public health, political crisis. That's not happening. So the problem is, if the vaccination certification app becomes identified with a party, there'll be supporters, but equally there'll be opposers. So that's why I think the NHS is very important. Mukesh Kapila, professor at Manchester University, has just tweeted that the WHO approved version is important. I agree. Because for all our criticisms of WHO, it is still the most equitable, most transparent international body we have. Yes, we have global funders trying to control various bits of its activities, but why? Because the WHO actually gives a stamp of authenticity, of trust to those activities. You know, many billions of dollars can't buy trust. Therefore, global funders have to go and connect up with WHO. The polio eradication program couldn't have been run just by the Gates Foundation. It needed to partner with the WHO to get international recognition. So we need to recognize the importance of these connections and labels. If we forget the importance of trust, all of these interventions are likely to become politicized and therefore opposed. So I'll end there.
And just to add to that point, which Sanjoy made about trust, which I think is an excellent point. It's not just about trust in the party or the institution who is promoting a digital vaccine certificate. It's trust in the information rights and the GDPR and the privacy and protection within the certificate itself. Now, Joseph outlined just a moment ago how the technology they're piloting is sort of private and is GDPR compliant, but it's not necessarily about if it is, private. It's about the perception of if it is, and the perception is almost more important than the practicality, because that is what will determine if people will or will not use this technology and sign up to it and believe in it. And individuals having a strong belief in the information governance underpinning any vaccine certificate, if it were to be a digital one, is crucial, and that's something that really cannot be overemphasized. And we don't really have any past experiences of this in this way. The international vaccine certification, which we see through the international health regulations, is a piece of paper. It is a yellow piece of paper, a physical piece of paper which you hold with you. So we haven't really got anything at the international legal level around digital rights and these vaccine passports. But I think that's going to be really crucial around perception and trust for the rollout.
Great, thank you. I don't know if any of the others wanted to come in, or one question that we've got, which I think actually goes to the heart of a lot of issues, is whether or not there are going to be different approaches to how this works in terms of different vaccines, in terms of different countries, in terms of, I suppose, a more individualized approach to the sort of risk that somebody might have, either because of their background, their demographic characteristics, or because of the sort of vaccine they had, or how frequently they had the vaccine, or how recently they had the vaccine. I just wondered whether, Jenny and Joseph, those sorts of issues about something that is a bit less binary and a little bit more around a kind of somebody's health status or risk status are kind of under consideration.
So I think that is exactly the some of those governance challenges that we're talking about, right? Because so there's things that we want to have lots of variety in, which is the actual implementation, right? These, we want you to be able to run multiple wallet apps on your phone and have any of them work. We want issuers to be able to choose which software they use, and verifiers as well. The communication of what data goes between, how the data is read between those needs to be consistent, because computers can't, say like, oh, well, it looks, like, you've been doing this and that, and so we'll let you, right? Computer needs a rule that says yes or no very strictly, obviously. And I think that where, a country might be able to decide that, one example is that the UK is saying that you can have a longer period of time between your immunizations than the US is saying. So the challenge there is going to be the US is going to need to decide, do they accept people who have had the two, if you've gotten the 2 vaccinations in the UK, the certificate is probably not going, does the certificate need to say how far apart they are so that the US can decide whether or not they accept that? Or is the US going to say, the UK, you're one of our partners, we accept, we're going to just accept that if you say somebody's vaccinated, then you are vaccinated. These haven't been solved yet. And it's going to, I think these certificates are a way to allow people to trust each other again, so that we can travel, right? Like, so essentially it's a way to say, listen, I am safe. I can come over. And exactly how that's, I think there's still so much to figure out here. It's a really challenging question.
And I just wanted to put, thank you for that, Jenny. Just want to put a final question to the panel, which is whether you think there are any use cases where this shouldn't be allowed to be used, in terms of not just the build of the technology, but the the whole idea of a passport is that it allows something or it blocks something on the basis of it. And I just wondered whether you have any thoughts about how this might be picked up and rolled out in society and in different countries, and whether or not there needs to be some uses that are not permitted, or whether that's something that should be, should be kind of developed organically. Yeah, Joseph.
Yeah, thank you. So it's kind of the inverse answer to that, really, and that is right from the very beginning of trying to create this particular piece of innovation, we had to challenge ourselves as to whether or not it could be used by adults or by people who are not yet adults. So could a piece of technology be stood up, and could it be reliable enough for children to use, for example, in order to facilitate, say, the return to school, the return to college, or return to university? We believe that the innovation that we've created certainly can do that, because of the way in which it's designed and because of the ethical stance that we've taken in its creation. So for us to be able to answer a question like you just posed, where should it never be used? I mean, that's actually quite a big and open question, and the only answer that I could give to that right now is really wherever a nation state that adopts it, say the UK government, if a solution like this is to be adopted in the UK government, by the UK government, we would need to satisfy the requirements that they put down for the use of such technologies.
And building on that, one of the problems then we might run into is that there is a lack of standardization across vaccine certificates, which is the very issue that the Annex 7 and the international health regulations sought to overcome, which is the problem that Sanjoy outlined right at the start of our webinar, which is that some vaccine certificates were considered to be better than others, and what the risk of the solution which Joseph just outlined there is that we could end up with a situation where the standard imposed by the US is different to the one imposed by France or the UK, and so on and so forth. And then you get into a situation over which one is best and which one is trusted and which one is not. And the more certificates which we have, or digital certificates which we have thrown into the mix, it's the more likely there is to be an attempt to put them into a hierarchy and place trust within that hierarchy. And that's something that we really want to.
Great, thanks so much. Ooh, yes, Sanjoy.
Yeah, so for me, I think the important thing for us to keep in mind is that we are in a pandemic. We are in a once-in-a-lifetime experience. And this is a point of time when there has to be public responsibility. Okay, so I think what shouldn't happen is that there shouldn't be a decision passed that then results in individuals having to engage with profit-making private initiatives, because I think that is going to be counterproductive. So if we are going to go around in any country in this world claiming we're all in it together, listen to public messaging because we have the best information to keep you safe, then that talk needs to be followed up by action, that is public support for such certification. Because talk is cheap, and then imposing costs on families that are already struggling in a pandemic era shows that they really don't care, the elites are out of touch. And if we don't do this, then we'll be strengthening this side of the vaccine hesitancy lobby, which I don't support at all, but I'm very scared of, because they work with very simplistic ideas and messages, and they could grab on to this message that, oh, look, this vaccine passport is another profit-making measure, and therefore oppose vaccination. So my concern here is to do everything that promotes vaccination. And unless there's public support and public responsibility, there won't be a strong vaccination regime.
Thank you so much. We've got loads more questions. There's a lot we could talk about, but I'm afraid we're out of time. We are going to capture the questions in the chat and the Q&A and see if the speakers are willing for us to follow up with them, but otherwise roll them forwards into another event. I just wanted to thank our speakers primarily for their contributions today, especially, and everybody for joining, especially given everything else you've got going on in your lives at the moment. I should say that next week, this is a series to really draw out some of the evidence and perspectives around this. Next week, we've got a blockbuster week on Tuesday at midday. We're going to be looking at the economics and epidemiology and the science around vaccines, the idea of vaccine passports. And then on Wednesday at 1 o'clock, we're going to be exploring the ethics, and we've got ethicists taking, I think, different positions around this, which should be really fascinating. So we'll go live with information about that shortly. Do check back on our site. And this runs along and inside an international call for evidence. So if anybody here has felt like they really had views they wanted to share, we would love to hear them, even if it's just top line. We know this isn't an area everyone has worked on for years. This is an urgent and emerging question. So we would love to hear from you. Do get in touch. I think we will leave it there. Thank you again to the speakers. It was really fantastic first event, and I really appreciate the time you put into it. Thank you.
Thank you, everyone.
Thanks.